listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, what happens when your client's Affordable Care Act plan is being discontinued? We've got the answers in How Plan Crosswalks Work in the ACA Marketplace, written by Emily Ryan. When a marketplace plan is discontinued, don't worry. Your clients aren't left to wonder how to obtain new coverage. They're automatically transitioned or crosswalked to a new similar plan. Let's discuss how these transitions work in the marketplace, things to be aware of with plan crosswalks, and why they occur. So, what exactly is a crosswalk in health insurance? In the health insurance industry, a plan crosswalk occurs when enrollees from a discontinued plan are transitioned to a new plan with similar coverages in the same tier. You may also hear this movement referred to by others as health plan mapping. But the Centers for Medicare and Medicaid Services, CMS, refers to this transition as a crosswalk. Now, let's dive deeper into how plan crosswalks work in the marketplace. If an Affordable Care Act ACA carrier is no longer offering a particular plan or is leaving the marketplace, your clients will typically be reassigned to a new plan from the same carrier or a different carrier with a similar network and the lowest premium. Crosswalks hold true for all carriers and plans operating in the federal marketplace. However, they may not necessarily occur in state-run marketplaces. Each state-based marketplace reserves the right to crosswalk enrollees to a new plan or alert them that their coverage is ending if their plan is being discontinued. When a client receives this notification, they will be able to select a new plan during a special enrollment period, SEP, to receive coverage. How your clients can avoid being crosswalked. Before a plan is discontinued or a plan exits the marketplace, your client will receive written notification that these changes are happening. They will likely receive this notification in the mail a few months in advance of the OEP. Encourage your client to stay up to date on all communications from their insurer. If your client receives notification that their coverage will be changing, they'll be able to select a new plan within an SEP. Remind your client to select new coverage within the 60-day timeframe if their new crosswalked plan is not ideal. Your client can also select new coverage during the OEP. By selecting new coverage, your client does maintain more control over their insurance. However, it is the goal of the marketplace to select the most similar plan for clients who are being crosswalked to a new plan. The selected crosswalk plan might be the same option your client may choose. Explore all available options in your client's market before selecting a new plan. Why do ACA crosswalks exist? The ACA was designed to protect Americans who are susceptible to being underinsured or going without health insurance because they can't afford it. Currently, as a default, when plans are discontinued or carriers exit the marketplace, a client will be crosswalked to the most similar, lowest cost plan to help ensure that individuals don't go without coverage. Crosswalks also keep individuals in the health insurance exchange. For example, a few years ago, many carriers were exiting the exchange, but were still participating in the off-exchange market. By default, clients are crosswalked to another plan on the exchange to maximize coverage benefits. By auto-transferring clients to a new plan, individuals don't unknowingly go without marketplace coverage. This process greatly contributes to the low insured rate. Next, let's look at what to watch out for during an ACA crosswalk. When your client is crosswalked to a new health plan, be aware that changes can occur that require attention. Here are some of the major changes to look out for. Differences in premiums. When clients are crosswalked to a new plan, it's possible that their new premium will be higher than the premium they were paying. This happens because sometimes the closest approximation of coverage is more expensive with a new carrier or plan. Changes in network. Individuals may also notice that their network is different. In the worst case, some prescriptions or doctors may not be available. To receive care while being covered, your client may need to select a new physician or hospital network. Otherwise, if your client wishes to continue seeing their current provider, this care will be more expensive than before. Metal tier plan availability. For the 2025 plan year, your client is enrolled in a higher tier plan, Silver, Gold, Platinum, that is being discontinued, and there is not a plan of the same tier available with the same network. Your client may be crosswalked to a new plan of a lower tier. Your client may notice differences in premiums and what costs are covered. Your client's subsidies may change as well. Additionally, if your clients are receiving cost-sharing reductions or subsidies, they may still be applied to the new plan if your client's eligibility has not changed. If your client's income, household size, employment benefits, and so on have changed, they will have to update their eligibility application before receiving and applying subsidies. Clients who currently receive subsidies will be crosswalked to a similar Silver plan. You can use the calculator from healthcare.gov to estimate what your client's cost reductions could be. We'll have that linked in the episode notes for you. Higher subsidies are available through 2025, thanks to the Inflation Reduction Act. If your client is not currently sharing current tax return information with the exchange, your client will be crosswalked without subsidy determination. Subsidy considerations. If an individual is eligible for cost-sharing reductions, but is currently not using them and is enrolled in a bronze plan, when they are crosswalked to a new plan, they will be enrolled into a Silver plan to utilize subsidies and reduce healthcare costs if one is available within the same network. Implemented for coverage year 2025, if your client has failed to reconcile subsidies for the past 2 consecutive years, their subsidies will be terminated. Currently, clients who are not eligible for subsidies, the previous auto-enrollment process will be used. A client will be crosswalked to a plan with a similar network, same metal tier, and same product type. There may be changes coming to subsidy considerations. In the proposed rule for Plan Year 2026, the Trump administration proposed to remove the re-enrollment hierarchy requirement. Currently, eligible enrollees are automatically re-enrolled from a bronze to a Silver qualified health plan if it has the same network and the new plan has a lower or equal premium and is also a qualified health plan. The proposed change would eliminate the requirement to, quote, respect consumer choice and reduce confusion, end quote. The change may benefit enrollees in that they might be unaware of liable subsidies when filing their taxes. Another change in the March 10, 2025 announcement, CMS proposed changes to subsidy reconciliation and enrollment dates for Plan Year 2026. CMS proposed reverting back to the 2015 policy that requires, quote, exchanges to determine an individual ineligible for advanced premium tax credits, end quote. Additionally, it was proposed that the federal annual open enrollment period be from November 1st through December 15th. This would shorten OEP by over a month and make the blanket date for effective enrollment coverage January 1st. As we mentioned earlier, these proposed changes debuted on March 10th. We can expect the changes to go effect on May 10th unless CMS proposes more changes. We'll be keeping an eye out for more announcements from CMS, so be sure you're following along with our show to stay up to date with industry news. Health plan mapping, or crosswalks, are one patient protection embedded in the ACA designed to reduce healthcare costs and eliminate coverage gaps. As your client's trusted agent, remember to encourage them to stay on top of communications from their insurer and educate them on crosswalks to put them in charge of their healthcare coverage. Here at Ritter Insurance Marketing, we want to support you so you can better support your clients. Become a Ritter agent today to benefit from our educational resources, exclusive carrier contracts, and dedicated sales staff that is available to answer questions and help you find the right product for your portfolio. You can learn more about registering for Ritter by visiting the link in the episode notes. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan, script proofing by Sarah Ruppel, recording and production by me, Tina Lamoureux. Podcast design by Urban Rivera. Rate and review our show on Apple or Spotify.